When I started seeing patients, I thought I had all the knowledge to cure their chronic pain. It was almost 20 years ago, and I was wrong. It took me 8 whole years, seeing thousands of patients and going through a year of struggling with pain myself to be able to achieve better results in treatments. In this video, I'm going to share with you 10 eye-opening truths I wish I had known when I started, so you can achieve far better results in pain therapy. Truth number 1. Did you know that by the time you finish your training, your knowledge is already outdated? It's amazing to understand that, but the doubling of knowledge, the pace in which we have new knowledge about pain and pain studies is really mind-blowing. You have to always stay on top, you have to always stay updated so you can offer your patients the best treatment possible. So this is truth number 1. There's a gap knowledge and we have to always continue learning the new knowledge and the new science about pain. Truth number 2. Did you know that many conditions that were once considered incurable could be massively improved and sometimes even cured? Let me share with you a story. When I started offering treatments to back pain patients after my own recovery, I was aiming these treatments mostly to people who suffer from chronic back pain. A few months later, a woman that was diagnosed with fibromyalgia approached me and asked if this method could also help her. At the time, I didn't know that. It was more than 10 years ago. I didn't have experience yet with fibromyalgia, and I told her, hey, it helps with chronic pain. Let's try, nothing to lose. She started the program, and after 3 months, she was pain-free. That was really amazing. A few months later, she sent me pictures of her doing a trek in Italy, in the mountain region, carrying a backpack weighing 20 kilos. That was really amazing, and this actually showed me that many things that were considered incurable in the past could actually be cured in many cases. Truth number 3, it takes time. When I healed from my pain, it took me 4 weeks, and I thought that's the usual pace it takes everybody. But then I realized that the average pace, the average time it takes for people to cure their chronic back pain is anywhere in between 3 to 6 months. Sometimes it could be shorter, sometimes it could be longer. The thing is this, when people go to forums, when people hear testimonials, they always encounter those miracle cures that take 3 days, a week, 2 weeks, 4 weeks, 1.5 months. These are the outliers. For the most part, people need more time, but actually it doesn't matter how long it takes. What's more important is to see that change is possible, and when we start seeing changes in our patients, in our clients, then the road is open. Truth number 4, movement is key. Let me share with you a story. Many years ago, I was approached by a young woman in her 30s. She was a mother of 4 and working as a kindergarten manager. She was literally bedridden. She couldn't move, she couldn't dress up, she couldn't cook, she couldn't do the shopping. She was basically lying in bed, not being able to do anything at all. And while she was understanding the new concepts about how pain is generated in the brain, in the bodily systems, in the nervous system, she was too afraid to move. And we needed to break this fear, break this cycle of fear and avoidance, and help her regain activity. That was key, that was very important. And the lesson here is that even when our clients and patients understand how pain is generated, they understand that in many cases it's harmless and reversible, they still need to act on it. Without acting on it, it stays as merely theoretical knowledge and doesn't turn into their reality of recovery. Truth number 5, there's a wrong way and a right way to resume activity. There are actually 2 wrong ways to go back to doing our daily activities. One is not doing anything, as we said on the previous truth. The other one is acting on impulse. This is something that happens quite often with people who suffer from chronic pain. They have this day or a couple of days where they feel better, and then they go back to the gym or go back to running or lifting heavy things, which causes them to relapse. So while avoiding movement altogether is not good, acting on impulses without a plan is also not that great. So we want to teach our patients how to resume activities in the right way. Let me share with you another story. A while ago, I met a psychologist that shared with me that whenever she tries running, she pays for that by suffering from pain 2 to 3 days later. Back at the time, I didn't know what I know today, and I told her, well, maybe you can try running for only 5 minutes. And she looked at me hesitantly and probably was saying to herself, within herself, that that's not gonna work. Leaving this meeting, I had a strange feeling. I felt that I was giving her the wrong advice. And that taught me the next truth. When we guide our patients, when we guide our clients to resume normal activity, we have to do it gradually. Think baby steps. Think ridiculous amount of progress every day. So we have to find a balance between advising to progress every day, each day a little bit more with activity, but finding the safe space in which this activity can happen without paying later in a relapse. So that's truth number 5. Guide your patients to resume activity in a gradual way. This leads us to truth number 6. Emotions matter. Around 10 years ago, I met a farmer that was suffering from chronic back pain. And we talked about his pain, and I recommended him to process in some way or the other his emotions. A few weeks later, he shared with me this story. He went out to his orange orchards, made sure that nobody is looking, nobody's around, and shouted his lungs out. He told me that after doing that, his pain decreased 70 to 80%. That was really amazing, and it taught me how important processing emotions is when people suffer from chronic pain. So if you're a therapist, teach your clients, teach your patients simple strategies to help them ventilate their emotions. It could be as simple as writing a journal, writing about their emotions and feelings daily for 15 to 20 minutes. It could be even talking to friends about their emotions, about their tensions, and ventilating, letting it all out. And it could be even recording themselves on their smartphones, sharing with this digital listener whatever's on their hearts and minds. These simple strategies can help patients reduce their pain. I've heard so many stories like that from my clients, from my patients, that after processing emotions, after ventilating emotions, they had massive improvements. Truth number 7. Your clients, your patients are monitoring their pain constantly. This is something it took me a while to understand, and that's a very big problem with chronic pain patients, which is often overlooked. It's important for you to know this. Many of your patients, many of your clients are monitoring their levels of pain all day long. They wake up in the morning, open their eyes, and immediately they check whether the pain is there, how intense it is, what parts of the body are involved in it. And they actually do it all day long. So you want to be aware of that, and you want to guide them to shift their focus of attention. And instead of monitoring their pain, some people even go as far as measuring their levels of pain and writing them on their diary. So make them stop and shift their attention, shift the monitoring towards tracking their changes, tracking their successes. So instead of monitoring the pain, guide your clients, guide your patients to monitor their improvements. What was easier for them to do? Did they have breaks in the pain? Did they have reductions in the pain? Were they able to do more things more easily than they used to in the past? So have them prepare a list, track their improvements, and monitor that. This creates a positive cycle, it reinforces the recovery, and it brings about a lot of hope and motivation. Truth number 8. What we as therapists say matters. A recent study in the UK divided people who went through back MRIs into 2 groups. One group received normalizing explanations, sharing with them that many of the changes that are seen are actually harmless and they don't cause pain and there's nothing to worry about. Of course, when the MRI showed that there was no life-threatening or really dangerous medical diagnosis. The other group received explanations that were more traditional, so to speak, with all these Latin words that for lay people are really frightening. Nobody knows what degenerative changes means. Many people don't know that in most cases it's harmless. So the second group received such explanations. Can you imagine what happened later on in the following months and years? Well, the group that received the neutralizing, normalizing explanations did way better in comparison to the other group who received the more traditional, structural-based explanations. This shows us that information is so important to our patients, and actually what we as therapists say to our patients, say to our clients really matters, and it also influences their outcomes long term. So what we say matter. Make sure to always use encouraging language, normalizing language, explaining your patients, explaining to your clients what they really have, what they shouldn't be afraid of, and giving them the right encouraging data. Truth number 9, pain in many cases is reversible. It was once thought that pain is always created by structural damage or tissue damage in the body. But in the last 2 to 3 decades, there were major discoveries that show us that the organ in our body that's creating pain and perpetuating it is our brain. Now, let's connect the dots. Pain is created in the brain. Our brain is neuroplastic. It means it can change if we train it in different directions. So, if pain is created in the brain, chronic pain, and the brain could be changed, it means that pain can also be changed. So the reality of neuroplasticity shows us that in many cases that were once thought incurable or irreversible, we can actually effect change and help people heal from the pain and release themselves from it gradually over time. Pain is also neuroplastic. There's also a medical term, a scientific term for that. It's called nociplastic pain. And there's a lot of research going on in the last years that shows us that and teaches us how to work with it properly. Truth number 10, success stories matter. Did your clients ever share with you that they went to Dr. Google to get some advice and came back with horrible predictions, horrible diagnosis, and a lot more fear and then avoidance around their pain? This is very common, and many times when people do it, it creates in their life a spiraling down effect that really worsens their situation. So instead of that, what we want to tell our patients, what we want to tell our clients is to research the success stories of people who recovered from similar symptoms to theirs. We want to connect our patients to the possibility of breaking free from the situation. And what's more encouraging than seeing somebody else that was suffering from a similar condition to yours being able to recover and be free from that? Success stories really matter because they foster the belief in our patients, in our clients, that they can do it too. So if other people could do it, I can do it too. And that's the mindset we want to create in our clients. So these have been the 10 truths I wish I'd known when I started treating pain patients. If you want to know how to close the knowledge gap and be updated with the latest research and resources about pain healing and therapy, I've linked here on the screen a video for you so you can dive deeper, enrich and deepen your professional knowledge and help your patients recover from pain better. Thank you for being here, and I'll see you in the next one. Bye-bye.